Hi, and welcome to Los Angeles, California. I'm Jennifer H. Caldwell, your host for Brighter, where I go around the world and around the block to bring you the stories of people who are doing what they can to make the world a brighter place. And we could really use that right now. I am so excited this time. Of course, I'm excited every time for my show, but this time I had a nice chat with someone who I've known for many, many years. She used to live here in Los Angeles as well, and we both worked for a company that provided medical malpractice. It's the equivalent of medical malpractice insurance in the state of California for physicians here. And now she is still in the medical field, but in a very different way. She works as a physician's assistant for Presbyterian Medical Services. And she's there on the front lines in Albuquerque with so many stories. Sad, heartbreaking, hilarious, touching, inspiring. So many stories she has to tell. And I was very fortunate to be able to sit with her this morning and have her tell us some of those stories. So without further ado, I'm going to go ahead and go on to the interview, which took place just this morning. Thank you for being here.
So what kind of stuff are you going to ask me about?
Well, I want to be asking you about your work in the medical field. I know you're there.
Yep, I am not doing the hard work though. My friends are doing the hard work. They're in the ICU.
Mm-hmm.
And I worked with one of my friends the other day, and I asked her, how is it really as a nurse in the ICU? And she was seeing patients who'd been flown in from Gallup, so they were the sickest of the sick. And she was talking about how for the whole shift, you're just constantly monitoring 8 drips. Where are they? Are they bucketing? What can you do to bring them back? And the medicines, and they're frustrating because none of the medicines here are working. And then we went and worked a little bit. We had a slight break, and I asked her, well, how many people are you sending home? And she looked me straight in the eyes and said, Joan, none of them. They all die. I can't imagine that job.
No.
I'm doing the easy work. That's why I say I'm just a worker bee. I'm not doing anything like that. I feel like I'm doing things of value. Sorry.
Oh, don't be sorry.
In that we need to be tested. We need to know who the asymptomatic people are. Yes, many of the tests are negative, thank God. But the ones where they are asymptomatic and are sharing, those are the people we need to identify, because that's how this gets spread.
Right. Of course.
And the other day I had the opportunity to go down into the south part of the city, and it was interesting. The men who came through after work because their wives wanted them to get checked, because the wives are at home holding down the home fires, right? Taking care of the kids, taking care of everything, and not going out. And the husbands are going out and making the living, and they have to be out and doing things, and they're wearing masks. And these are the true working class, excuse me. And they were scared, and their wives were scared and said, get there, get tested. And you could see the fear in their eyes. And yet at home, I'm sure they held up. They were tough, but their wives wanted them to come. I got to see a lot of those people. And then when I see the older people who, or my age, I keep forgetting I'm older now.
Well, you look great.
Thanks. Hitting 65.
Even with no makeup.
Later this year, it'll be 65. And that I have to remember is now considered older.
Yeah, I have to remember these things too a lot.
But the older people coming in who are taking care of their parents.
Yeah.
And they're just coming through the line. And what I do is hold their hands as they cry. They want to be tested. They're the ones going and getting the groceries and taking care of their parents. And what if they bring it home to their elderly parents? You know, that's what I do is I hold hands.
Wow.
That's not medicine.
Well, I kind of think it is, you know, I mean, that's needed.
It is.
It's all a part of it, you know.
Yep.
I remember being in, I don't remember, I visited several Latin American countries, and I was in one where they were talking about how amazed the people were the first time they got to see a doctor and that they actually touched them.
Wow. Wow.
Because, you know, that had never happened before.
And that's happening less and less here now.
Yeah.
Fear.
Fear, but not unfounded fear, I believe, although I know people who don't
I
believe
do too.
that.
I do too.
And well, actually, I don't know if I know them, but I see them, you know, on Facebook, etc. And I loved recently what you had, by the way, up on your page with the person with the umbrella talking about being in different boats, how we're all in different boats and we're handling this storm differently. And so not to judge.
Yep.
I thought that was really beautiful, Joan, because, you know, it's easy to get mad when I walk outside and I see someone without a mask, where here it's mandatory that you wear a mask. And I feel like they're basically saying, fuck you to me.
They are.
Yeah.
They are.
So it's really hard not to judge that.
Yep. I don't go out very often. And I truly am living in fear.
Mm-hmm.
But there's some positives too. Businesses are really trying to make a difference. I got a nail in my tire. Well, guess what? You got to deal with that.
I love it that you're going to bring up the positives.
You got to deal with that. I went to my tire place where I always go and have gone for years.
Uh-huh.
In the Northeast Whites. All over too. It's a chain. But I went in there and I called ahead, made my appointment, put my flashers on out in the parking lot, and they came out with their mask. What can I do to help you today? Well, yesterday I was here and got my tire filled, but found out I had a nail, need to get it fixed. Okay, we'll have you pull right into this bay. Really? You are going to have me drive in on that route. Okay. So I pulled in. It's like, am I doing the right thing? And they directed me. They did everything around my car. I never got out of my car. And then there was a window between the bays and the showroom where you pay. And there were people standing in there, like 4 people with no masks on. And so I asked the technician, do I have to go in there to pay? And he said, no. Not a problem. If you want, I could take your card in there. We offer that service. I never had to get out of my car. And it was so wonderful, but they offered the opportunity for those who chose not to wear a mask and those who chose the alternative of mask and protection.
Wow.
And I thought that was great. It was a neat thing for them to do because we aren't required, we're requested to wear masks in this state. And we are the Wild Wild West. You grew up here. You know that.
Yeah, I know. In a much wilder place than Albuquerque.
Truly. Truly.
Yeah, up north, it's a different world. Yeah.
My husband asked me, was your family ranching or what were they? What did they do? What did your family do?
Yeah, they did have a ranch. We did have a ranch. We had
How
a ranch,
wonderful.
and then we also had a business in the small town 7 miles away.
Wow.
Yeah.
See, I never knew that. So that's cool.
Wow. All those years I've known you.
Yeah. I just knew where you were from. I didn't know what beyond that. So that's cool.
So tell me, you've got so many stories. What is, if you could think of one that is like, that really inspired you? Well, first of all, let me back up a little bit. What is it that, because when I knew you, you weren't exactly in this profession.
No,
Um, so
but
what
that's what
inspired
drove me.
what?
True. That's what drove me is what we did together.
Oh,
In handling all those claims, I
uh-huh,
became very disillusioned by the adversarial legal system.
uh-huh.
And what did I like about my job? I liked the medicine. I always liked the medicine. And so that was the thing. It was like, can't do this anymore. What should I be doing? And it drove me to where I am now. And I'm much happier now.
Oh,
Not
that's
always.
great.
All the mumbo jumbo and the administrative stuff, everybody has that problem, no matter what. But
Yeah.
it's the patience. Once that door is closed, it's the patience that drive my passion.
Well, you can tell. You can definitely tell. You can tell it in all your Facebook posts.
I try to be positive there, but I know sometimes I'm not.
Well, who can blame you? Everyone deserves a moment or two or three.
I post the other night after working I was so frustrated because the faces that we see and the voices that we hear are everybody get tested. Everybody who wants to get tested can get tested. And it hit home for us this week because we've been doing okay with our swab supply.
Uh-huh.
And it hit home this week where we don't have the swab supply because of political differences.
I saw that on
And
your Facebook.
it was frustrating because I'm going to tell you right now, but not anyone else.
Oh, well, this is the show, so
This is the show.
yeah.
Oh, oh, okay. Well,
So tell me that soon.
it's just that I will tell you
Okay.
there is a need
Yes.
to get tested for all the reasons we've been talking about. And we have banners across the freeway, those electronic banners, that usually tell about traffic jams, but saying, get tested. Governor wants you to get tested. We see it on the TV. And yet we can't all of a sudden. And it was so coincidental that the governor's message of get tested was out there, really a big push, when all of a sudden the supply diminished. And
are people heeding the call? Are people coming more than ever to get
more
tested
than
because?
ever because of the message from the governor. We want every worker to get tested because that's a risk. The workplace is clearly a risk.
Right.
And that's why people are doing things from home. But many people don't have that as an option. And as you well know, this is a poor state.
Right.
And so we have a lot of, please forgive me, but blue collar workers. And those are the people I love to work with because of their heart. They do what they do and they make it happen, and their families are wonderful. But we need to get tested, and people are coming through now more than they had for the last couple of weeks. And we're being told, well, use your judgment. You're the provider. You make the call whether people get tested or don't get tested.
Oh, God. But that goes back to the asymptomatic people that we were talking about.
Truly. And so I may spend more time talking with people to see, where have you been? What do you do? Where do you do that? Otherwise, do you go out to the store? what do you do? Who are the people around you? And I will tell you, there is a reason, an exposure reason, for just about everyone I talk with. If you talk long enough to people, they are in the world.
You see a place where they probably were exposed.
Yes.
Is that what you're saying? Uh-huh.
Yes. And these are healthy people. Not that healthy people don't get sick as well. That's the other thing is, you know, you're not invincible just because you're a 40-year-old male in great shape because you work outside or, you know.
Right.
So
well, this is awful. I mean, is there any
well, we will get new supplies, and
okay.
they're coming next week.
Okay. So that's good.
That's great. That is great. So we will have them. Who knows how long these supplies will last? And certainly, you know, here we are, we're in Albuquerque, and then there's the rest of the state. And I think, please don't hold me to this, but I think we have 33 testing sites statewide.
Okay.
Couple of weeks ago, I had doctors that we were talking with to get screened who were driving in from Gallup because they couldn't get tested there. Is that crazy?
That's crazy because I know that's an epicenter, a big epicenter.
It's huge. It's huge. So I'm glad we're here. I think that our governor was incredibly proactive and got right on this. And we set up the primary center. We had to move it, so it's at Balloon Fiesta. Have you ever been to Balloon Fiesta Park?
Yes, I have. I did go one year. It's
big, as you well know. Isn't that a beautiful thing we probably will not have this year? But we are there now, and we have set up, and it's incredible how efficient it is. And I'll get back to that because there's one inefficiency there beyond our control, but it's really efficient. And we took that same model to the mobile unit out of one of those great big buses.
Uh-huh.
And we put everything in there. We have the tent company go out the night before, set up our tents. So we get there, we unload the bus, and we get going. And that's where we've been able to go out to many of the pueblos. Mm-hmm. And we've been able to go into the south part of the city where I was earlier this week. And we started the mobile unit at the nursing home here that got hit so very hard early on.
Uh-huh. You know, in your Facebook page, you were talking about your experience of going to the pueblos.
Yes.
It's really, I mean, even pre-COVID, those were such underserved communities.
Truly. They have health advocates that do such a good job, but they're limited, right? But they do such a good job. And it was interesting to see how, I'll gather myself here, how each one of them was so very different in character, and how this disease has hit them differently, and then the response. And the ones that are closer to town here seem to have been hit harder. And I think that's because of the exposures of the people traveling back and forth.
Right.
And the ones that are a little bit further away, they seem to be healthier and not quite as devastated by this. Although that's not entirely true. I mean, that isn't true, but it just had that feel.
Like it was true in some cases.
Yeah. But I had
some of the further ones were less hit.
Places like Navajo.
All of the ones right around Albuquerque were hit hard. Is that what you're saying?
Kind of.
Okay.
and I don't want to name names or anything like that.
Right, right.
Closer, there was some more cavalier attitude as well, not completely, but somewhat more cavalier. And I think that was represented then in the number of cases. And yet you take, the Navajo Nation, the Zuni tribe, they're much further away, but yet they've been hit hard. So I don't know, but there was a feel of the ones I went to. I did not go to Zuni. I've been to some of the others. And it was hard, but it was wonderful as well. We do these visits in a car through the window, and I'm sure driving up and having some crazy lady with all this PPE who you can't see the smile or the expression, but then hopefully they can hear it in my voice. And I got to meet some fascinating people. And in some of these tribes, I'd say, well, what kind of work do you do? Well, I'm an artist. What is your art? What do you do? And they pull out their cell phones, and I got to see pictures of the most incredible artwork that these people are doing. And the ones that are home and doing their artwork in their home, I think are healthier, because they aren't out and about. They've got their job right there in their home. They're creating beauty, and they're creating beauty of their culture that will survive. And that's one of the things I worry about is the devastation of the culture.
Yes.
So I think that was really neat. I got to meet such fascinating people. I had a good time. Maybe I wasn't
such an important part of their lives. I mean, you may say it's not important, but I think it is the hand holding, the smile behind all the PPE.
They can't see all my chins, thank goodness.
You're so funny.
Oh, but it's been a trip.
Yeah.
It's been a trip. And now it will be interesting to see what emerges of our healthcare system.
Right.
Through this, because the healthcare system as we know it will not exist. I think this is, whether people like it or not, we will be in a socialized medicine system to deal with this COVID-19 pandemic for quite some time.
Well, some people are trying to make sure that does not happen.
Well, it is happening.
Whatever the cost.
Right, it is happening, and it is going to be a model that we need to look at closely and see what worked and what didn't work and how we can go forward.
Joan, you're so awesome.
Thank you.
I mean, really, I've seen your Facebook posts. I've been sharing them with my sister. And the other day I was talking to my sister, Janine, the one who lives in Albuquerque. I was saying, I don't know who to have as my next guest. She said, I think you should have Joan Prouty. Yeah.
Oh my gosh. Well, thank her very much.
You've been telling me about what she's been doing. And I said, oh my God, that's perfect. She's so perfect. You're really.
Thank you. And thank her as well. My goodness. I just didn't, when you invited me to do this, I thought, okay, I don't know much about this, but I'll do whatever I can, because I think the message of my colleagues needs to be out there too, because we saw all the burnout in New York, because there's
Right.
a huge number of people, but that burnout is happening in every town.
Yes.
Across the United States and the world.
Yes.
That burnout is happening because people who are doing that really, really, really hard, intensely hard job are seeing death. If they had been ICU nurses previously, or are ICU nurses currently, they're used to having, really sick people die, but that was few and far between. Usually people were in there for 3 or 4 days and they saw an improvement and they were able to escalate them to a lower acuity level of care. But that's not happening with so many of these people. They're seeing their intensely sick patients die. And
does it matter the age?
No, it doesn't. That's what's frightening, is you think, oh, well, they're just the old people and this is Darwinian, you know. Well, no, it's not. We don't know enough about this virus to know what the common thread is for who are going to be the sickest of the sick. It's not who we think. It's not who we would normally in our model assume would be the sickest of the sick. Anybody can be sick.
From what I've read, it seems like, it seems to have something to do with some underlying core immunity, but it could be anybody.
It could be anybody. And the children. So far, we haven't had any deaths in this state from that inflammatory aspect for the children.
Uh-huh.
But that's frightening to think about.
Yes.
Because by and large, children are, they get viruses and they get better. Kids are not bulletproof, but they bounce pretty well. Please don't take that the wrong way, but we see them.
No, I know what you meant.
That sounded really bad. Oh boy. But they get sick and then they rebound. How does that sound? Bounce, but rebound would be a much better word.
Right.
Rebound so incredibly well from being ill. And they are doing that with this generally, but they get really, really sick from this too. So it's not just the old people dying off because they have a multitude of underlying health problems.
Right.
And it's middle-aged people. It's everybody. Who knows?
Yeah. Well, Joan, is there any last thing that you want to say? And then we can stay and chat about this, but that's going to be my marking point for the end of the show, and I'm going to stop recording.
Okay.
If you have anything else that you'd like to say, you may not, but if you do.
I don't know. There's so many things, and it's about finding peace in your heart with all of this. Whatever your political persuasion, your feeling about the disease, but find peace in whatever you're doing and be kind with each other. Because we're all in it. Sorry.
We're all in different boats in the same storm.
Yep, we're all in it. And just find peace in however you go through it.
Have you found a certain way you want to share? And you don't have to with that either, but is there anything?
No, I haven't. Not yet.
Okay.
I will, and you will, and we all will. Because that's how we make it through.
Yeah.
And each day, we look at it differently. But find some way to find peace and be kind to one another.
Thank you, Joan.
Thank you.